begin. It was interesting to me that both of you have utilized other types of providers and contacts. Mr. Hubbard, for example, is a very unusual and atypical partner. And Ryan, in your clinic, you had lay health leaders that really drove these changes. Those are, I think, there are lessons to be learned there about working in communities of any kind, but particularly underserved communities. And I wondered if you could just expand on the use of other community leaders in the development and sustainability of your programs.
I'd like to, just to go back to Myrna Valdez, I mentioned who's actually a patient registration clerk at our health center. Actually, one of her children was participating in our program, and she really, as WeCan developed, learned quite a bit in terms of her own self-efficacy and healthy living, healthy nutrition, healthy activity. I mean, just seeing her in the lunchroom preparing her salads is encouraging to me and makes me come back in the right direction often if I've veered away. But I can tell you just an experience of trying to do one of these field trips on a Saturday without Myrna versus trying to do something with Myrna. I think I had 4 people show up on a Saturday when we didn't have her, but she just has developed such a rapport with the patients over time that they get a call from Myrna and they're there. They know what's going on and she's got their trust. So.
Sure. I would also mention, I work with my colleagues Marshall Chin and Monica Peak at University of Chicago, are running a collaboration called Improving Diabetes Care Collaboratively on Chicago's South Side. And we have 6 clinics in this program that include 4 community clinics, FQHCs, and 2 of the academic clinics at U of C. And we work and partner with food pantries, farmers markets, grocery stores, local chefs, and so forth, because we have a lot of knowledge about diabetes and obesity, but it needs more than that, and we need to learn and understand and teach our trainees how to speak to folks, and then also how to help patients and community residents find those resources that can make it real and sustainable. So that's a different kind of expertise, but that is absolutely essential also, and so those are some of the other partners that we have. And now, out of that research project, we've brought, we got all these reference lists, so we got, food prescriptions also, food RX, and we got them in our clinic. So even, it spills over beyond the research project. So that's the things that we're doing in addition.
You're both in under-resourced communities as well, and yet the counseling that you're both doing and the programs that you're both doing are focusing on physical activity and improved nutrition. So how do you deal with the lack of those resources, and to what extent has that pushed you into a broader initiatives around community advocacy for healthy corner stores or more parks and recreation facilities or neighborhood safety?
Yeah.
Certainly, as I said, DC's got a ton of parks. We've got some right nearby, and many of our patients, although they live right in the community, because of language barriers, other barriers, cultural barriers, sometimes they're not aware that, hey, they can go to the local rec center. And so we'll take patients on a tour of the rec center. And one of my favorite stories was of a patient, Douglas, who was coming on a regular basis, a 10 or 12-year-old boy who was making progress in his healthy activity, and then he and his sister, Ileana, stopped coming to our WeCan program for a while, and then a month or so later, we took another group of patients on a tour to the local rec center, and there I saw him in a Taekwondo uniform with his yellow belt, and I thought, oh, wow, this is even better. So I think it's the lack of familiarity sometimes with resources that are already there, or lack of resources is something that certainly has engaged us.
It's trying to find them and make them known and available, but also advocating to get them. And I had 2 examples. Stacy Lindau is my colleague at U of C, and she's got a whole army of high school kids from throughout Chicago that get engaged in this project and hired every summer. And they go out and walk the streets and map everything in a neighborhood, everything except private residences, because the Around Me and the other services, they don't concentrate on the south side of Chicago. They concentrate on places with more businesses. So they have an up-to-date, now it's publicly available, list, and then they fill in, what are the services and so forth. And then the other thing is, right, I showed that diabetes map and complications, and of course it's just the flip side of what are some of the resources. So if you looked at parks, and in Chicago we call them Class A field houses or Class 1 field houses, and there's a dearth of those on the south side of Chicago. So we worked with, Barack Obama was our state senator before he became US Senator and President, and so we worked with him to lobby to get, Chicago Park District to put a Class A field house on the south side in our neighborhood. And so, and that empowers so when there's an opportunity to come to a table like that, I got my partners, Lori McClinton Powell, the teacher, I got people from the schools and the communities, and so you can come together and do some powerful things. And we also send our docs, I'm the chief of general medicine, I send my junior faculty to SGIM Hill Day, teach them how to do lobbying advocacy for, medicine and for underserved communities.
I think also to my colleague Robert Czar working on the DC Park Prescription Program, which will have an available website coming up soon. But he, when realizing that many of our patients weren't able to, they didn't know where the parks were, didn't know if the parks were safe, what services were available, partnered with others. I mean, we don't have a ton of money lying around to do things like this, so he was able to secure some small grants and work together with physical therapy students, work with public health students who were able to go out and in a systematically way assess all the parks. So far 200 out of the 350 in DC.
So both of you have used the word sustainability, and I was curious about whether these programs would be sustained in your absence. I mean, you're putting resources into the purchase of fruits and vegetables for the family nights, and you've galvanized a group, and you both indicated that you have lay leaders, but where's the community ownership of these programs? Have you built? Do you think you've built that, or are these programs that are going to disappear if you disappear?
So the Power Up program is definitely embedded in this school now. This is their program because they're running it now. I don't have a grant now. I'm not running it, and they are doing it. And we interact with them from time to time. Mr. Emble, the principal, has become an ambassador for us, so we are trying to put together, a larger grant and collaboration with more schools on the south side, and he works with his, other colleagues who are principals and introduces us and, acts as a liaison for us with other schools. So, and again, part of it is the people who are there, but it's in their interest. They understand, it's in his interest for his constituents. So, finding those partners and finding things you can do together, it has become sustainable for that school, and we're looking and hoping to do it with more.
It's a great question, and I can't say that I know the answer for our program. I can say that at least financially, in the present environment, payment environment of fee-for-service, where we're paid for each additional visit, it works well. But when I think about transitioning in our business plan to move away from fee-for-service over time, that presents new challenges. But the fact that our program has really been, I won't say perfected, but really improved by our patients and their suggestions. When we, after using some of the more, some of the actual weekend curriculum initially, we realized that the parents wanted to have some separate time from their children, where they got to have an activity that wasn't overrun by kids running around, where they could do something themselves, maybe where they felt less embarrassed dancing or doing physical activity in front of all these other people. But the fact that we've learned from them and they've really
and that you weren't
engaged.
Embarrassed dancing.
Right, right. Yeah, that's helped. And,
Right.
and while Jessica's, the patient I talked about, distinct in that she's been a bunch of times, I think close to 50 times over the last year and a half. We're seeing improvements, and patients see that, and it's contagious. It really is.
And I think looking for policy and other incentive alignments really helps it become sustainable, because then a school can get recognition, they can get the, Go for the Gold Award and so forth.
Well, that brings me to my final question. I know in Chicago that Rahm Emanuel is really aggressively trying to make this city a very healthy city.
Yes.
And you've had Clock there for a number of years. I don't know whether you have a
Sure.
relationship with Clock. I think the DC mayor is also pretty outspoken on this issue. So to what extent do those changes in the political climate enhance what you're trying to do or begin to change the norms around what you're trying to do?
I think it helps tremendously. The Chicago Department of Public Health, of course, is part of the city of Chicago, and they are very interested in this agenda. They put out, an agenda that's clear, easy for people to understand. There's a lot of social marketing around it. And then so we have partners, and we have CDPH, they don't have a huge pocketbook, but they have leverage and authority and visibility. And so we work with them. They also broker further relationships with Chicago Public Schools, and that helps to raise the visibility and make everyone successful.
In DC, Mayor Vincent Gray, who comes from the social services background, he was in the nonprofit sector for many years, is certainly supportive, and it's something that I think is helpful, but at the same time, I don't think we're utterly dependent on the whims of who's in power, who's the mayor. And I think there is just so much momentum around the issues of healthy nutrition and healthy activity that I hope at least that momentum will continue for years to come.
The other thing those partnerships do with the city and the CDPH is, it enables bigger infrastructure. So there is a Chicago Health Atlas now, has data going into it from 5 academic medical centers and other hospitals and providers. And there's some neighborhoods in Chicago where half the residents are in this database. And then it's de-identified, but it can tell if a patient goes from Northwestern to UC, it can tell that it's the same person. And then researchers can come and look and see what are the patterns and where do we need to.
So you've got good metrics as,
yes,
as an underpinning.
we're getting much better. It's getting much better.
Yeah, good. Working on it. So in closing, I just want to let you know that I think I understand how Barbara Streisand feels, right? She only shows one side of her face because she's embarrassed. So is it this or is it this? So thank you.
Thank you.
Thank you.